You're watching Fox 51 Today.
Welcome back. Back pain is a constant problem for many of us, especially this time of year when East Texans are spending time outdoors on the lake or maybe sprucing up the yard after all this rainfall. So Dr. Guy Danielson with Precision Spine Care joins us. Good morning.
Good morning.
So today you said there are some red flags we need to look out for.
That's true. George Clooney, Dolly Parton, and President JFK all had terrible back pain. 90% of us are going to have terrible back pain at some point in our life. So I am very happy to be here, and I'm going to share with you 3 more mistakes that you must avoid if you have back pain.
Fabulous.
Wow, yeah, what are those mistakes?
The first mistake that we must avoid is ignoring red flags. This is important.
Sure.
Pay attention.
Yeah, listen up now.
Oh, all eyes.
Okay. Red flags mean that you have got a medical emergency. And when it comes to your back, that means that you're going to be getting increased pain, and the pain can be in your back, it can be in your legs. You can also get numbness in your legs, and it can be in your pelvic area too. You can have weakness in your legs, and you can have bowel or bladder problems, and those are very important that you do something about it right away. The reason is you can have pressure on your spinal cord, and it can come from any one of a number of reasons. Ruptured disc is one of the main ones, but if you have pressure on your spinal cord, it may require emergency surgery.
Oh, man.
So as a spine specialist, I spend a lot of time talking to my patients about this one issue. And it's so important that I write it down. I give it to them in writing, and then I give them my cell phone number so they can call me if it's in the day or night, because time is of the essence. So whatever you do, you can't ignore the red flags.
Okay, great.
Now, my second thing that you must avoid is bed rest. Okay, last week we talked about jogging being evil, and it is. But going to bed and doing nothing is just as bad. And we all get afraid, and it is very scary when you get a back problem and you go, I am not going to do anything. But if you don't get moving, we're really in trouble. What I do with my patients, I send them to a physical therapist, a really good one, and what they will do is they will evaluate the patient, and they will look at what the patient's condition is and put together a plan. The plan will include teaching them how to do exercises that strengthen their back, and also teach them how to do activities safely. So whatever we do, we don't go to bed. No way.
All right, no sleeping.
The third thing is taking narcotic medication. Now, most people know that narcotics are addictive, and that's true. But the other thing that's a little bit harder to understand is the situation that's called tolerance. What does tolerance mean? Tolerance means that if you take a narcotic, at first it works just absolutely great. You go, oh boy, this is wonderful. But you take it for a while, and your body develops the tolerance to the medicine, which means it doesn't work so well. And if it doesn't work, then guess what? You just take more medicine. And then that goes through that same cycle, and you keep taking more medicine, and then you can reach a stage where your memory isn't good, and you get confused and you forget you took the medicine. You might take some more. What does this lead to? It can lead to accidental overdosage and death. And this is very common. In our country, accidental overdosage from medications is actually more common than car wrecks, and that's hard to believe.
Wow.
That's not saying that there aren't times when taking some narcotics might not be a bad idea, like if you have a root canal or you're going to have surgery, that's fine. But if you have back pain, we never recommend long-term narcotic usage.
Right.
So that's my 3 mistakes to avoid.
All right.
More mistakes to avoid. And I have a simple back formula that is for people who have back pain and want to get better. B, brain. You must train your brain to eliminate the pain. A, attention. You must pay attention. You must be in charge. You must take control. C, consume healthy foods. If you don't have proper nutrition, then you're sunk. And K is for keep moving. Motion is the medicine.
All right.
So those are my 3 mistakes and my back formula. And I truly do believe that we can survive and thrive despite our medical system.
Perfect. Well, on that note, we are about out of time. Thank you so much.
Thank you.
So coming up next on